seconds.
Mr. President,
Senior Senator from Arizona is recognized.
I mentioned the AARP and their support or their opposition to this amendment. I'd like to also point out there's an organization called 60 Plus that has millions of supporters and members, and they also feel very differently than the AARP. Their message is, soon you will vote on the Mccain motion to commit with instruction. The motion would commit it to the Senate Committee of Finance, etc. I and the 5.5 million supporters of 60 Plus urge you to support this motion. The Patient Protection Affordable Care Act is nothing of the sort to senior citizens. It would cut Medicare by $500 billion. These cuts would harm seniors who have paid into the program and expected to be there to help them when their health care needs. At 60 Plus, we pride ourselves on advocating for the best interests of seniors, and that is a yes vote on this motion. My friends, let's pay attention to 60 Plus. And again,
could I inquire of the Senator a question?
Yeah.
Does 60 Plus sell a supplemental insurance policy to seniors?
I don't believe that 60 Plus sells a...
But AARP does.
AARP does.
It might explain why AARP wants people off Medicare Advantage, 11 million
most
people.
experts on the health care issue believe that this could be a windfall of millions and tens of millions of dollars for AARP if the legislation is passed as it is presently crafted.
Senator from Arizona, how many Medicare Advantage members there are, for example, in the state of Arizona? Is it a small program or a large program?
Our figures are 330,000 people in my state of Arizona. And I did notice yesterday when the distinguished chairman of the Finance Committee and the senator from Connecticut were talking, the way that they were disparaging the entire program, how it wasn't any good and about the cost overruns, and it really was a bad program. They've opposed it from the start. And so the message is to 330,000 Americans that citizens of my state who have Medicare Advantage, they're out to get you.
From Tennessee, my understanding is that nationwide, it's about 1/4 of all Medicare beneficiaries. So just about 1 in 4 of all Medicare beneficiaries in America will see their benefits cut. All Medicare beneficiaries will see their access cut. And these problems that we are talking about are not just limited in their impact.
Let me respond again. There are cost problems with the Medicare Advantage. Those cost problems can be fixed, and those cost problems can be brought under control. But the fact is, to do away with the program that allows them a choice in how they receive their care is, of course, again, an effort to have the government make the decisions for people, which flies in the face of everything we stand for and believe in.
I may say to the senator from Arizona, I've heard some of our friends on the other side say the Republicans are scaring seniors about Medicare cuts. Mr. President, not the Republican senators who are scaring seniors about Medicare cuts. It's the Democratic health care bill that are scaring seniors about Medicare cuts, because there are $500 billion of Medicare cuts that will pay for half of this new program, and they're outlined here on this chart as the senators have discussed.
The time for the senator from Arizona is expired. The senior senator from